Out of all 23 medical marijuana states, we are the only one that did not put in an age restriction.
She fears kids will have access to it. According to the wording of the amendment, it would have to be prescribed by a licensed physician. Morgan accuses Spencer's group of scare tactics.
If a doctor's going to abuse the loophole, they can abuse it right now with things that kill us.
Florida is now a major battleground in the fight for and against medicinal marijuana. Amendment 2 is pushing for it, and plenty of people are fighting against it. But there is now a new player in the duel to this hearts, minds, and medical care of voters. The NAACP has called this a civil rights issue, and one that has one side on the offensive. Welcome back to MidPoint here in the studio, a veteran of the governmental and political media relations wars. Also Newsmax contributor Clarence McKee joins us. And we're also joined by the Director of Strategic Partnerships for NORML, the National Organization for the Reform of Marijuana Laws. Sabrina Fendrick joins us. Sabrina, thank you so much for joining us. And Clarence, good to see you.
How are you?
Again.
Good to see you again, my friend.
Always a pleasure.
Good.
All right, Clarence, I'm going to start out with you because on Newsmax.com you started off this when you said, and again to the NAACP pushing for medical pot, to them it is a civil rights issue. You said this is a silly argument and compares apples to oranges. Explain.
Exactly. Given their theory, I would think that if you had a disproportionate number of black athletes who are being arrested for abusing their spouses, you would have to decriminalize that because it's some way a civil rights issue. No, this is not a civil rights issue. It's apples and oranges. The White House Office of Drug Policy has discussed this issue and talked about the disparity and said the disparity is not a discussion for public health policy. If there is a disparity in arrests, then we should take a look at it through the reform of the marijuana laws. But you can't say that decriminalizing marijuana is a silver bullet to cure the problems of arrest in the criminal justice system. And what scares us here in Florida about Amendment 2 is people are going to think that, oh, it's okay to use it now. Not true. The amendment, which we call the Drug Dealer Protection Act, is full of hidden loopholes. And it's very clear in there. You can't read it unless you have a microscope. This amendment does not have any impact on existing marijuana laws that don't relate to medicine. This amendment has no impact on federal law. Under federal law, marijuana is illegal. So you're going to have a lot of kids, particularly black kids, who are going to hear, oh, it's legal. They're going to go take it and use it, and they're going to go to jail. You're going to have these caregivers created by this act, 200,000 of them in Florida. The only requirement is they have to be 21 years of age. No background check, no medical training. They can have up to 5 so-called patients.
Okay. Let's leave it right there. The Drug Dealer Protection Act, you just called it. Sabrina Fendrick, I'm going to ask you to weigh in right now in your response.
Well, I would say, first of all, that this is not a discussion about civil rights and arrest disparities, although that is something that the African American community is dealing with. This is about public health and issues that people are dealing with on a personal level in terms of different health effects where no medicine has been able to help them. They are suffering from debilitating, painful diseases, and absolutely nothing else will help them. Medical marijuana is going to provide a safer alternative to people that are genuinely suffering and need safe access. This is driving them to the streets, to the black market, where they're getting who knows what kind of medicine or marijuana from that could be laced with something. You don't know where it's grown, you don't know anything about it. And this is just providing it, giving people an opportunity to access marijuana, medical marijuana, in a safe place under the evaluation of their doctor.
So Sabrina, with about 60 seconds left, then we will take a break, come back and do more. But I guess the question here would be, what about all the loopholes that are supposedly in this law that people seem to be taking advantage of?
Well, that's actually extremely inaccurate. There are no loopholes. The amendment actually says they're leaving it up to the Department of Health to create all of the regulations. Therefore, everything that the way that this entire program is going to be structured is going to be up to the state and up to the Department of Health. If they create a program with no loopholes, there won't be loopholes. I think that's just a scare tactic that really has nothing to do with this issue.
All right, now I know that Clarence, you already raised your eyebrows when you heard there were no loopholes whatsoever. We unfortunately, though, got to take a hard break, so I'm going to ask you both to stand by because I want you to go ahead and respond to that when we come back.
Definitely.
And I'm sure you are. Sabrina, get ready. I'm sure there will be a response. After the break with Clarence McKee and Sabrina Fendrick. Hey, what's so bad about feeling good? Plenty if it means other and another legal drug for Americans. That is part of the discourse. And later on this hour, back to the Wisconsin wall for Scott Walker as we dig deeper into this race for the hearts of midterm voters. And of course, when we talk about votes and elections, don't forget, election night, we're going to have complete coverage right here on the Newsmax Network. More to come right here on MidPoint, where we question everything.